Hello class, Dr. Mike Burford here. I want to talk with you today a little bit about clinical research methods, and of course this is our psychopathology class. We're wrapping up our series of lectures for this class. Certainly thought it was appropriate to talk with you a little bit about clinical research and how that might be of use to you and your clients. So first I want to say that a lot of the information that you'll hear today is taken from your textbook for this class, the Vital book. And so the book will actually elaborate on a lot of the things that I say today. My goal is to keep today's lecture fairly short and simple. My hope is that I get a few basic things across to you that you can find to be useful in your practice someday. And of course, deeper understanding would come from reading the book and maybe doing some research on your own, or if you have a real interest, you're free to meet with me and we can talk research all day long if you like. Well, I don't know about all day long, but we could certainly talk with it until your ears are full, I'm sure. All right, so let's talk about research in general for a minute and how it might pertain to you and your clients. Have you ever thought about how we've come to know the things we know about psychopathology? Have you ever considered the genetic factors in psychopathology? Have you ever asked, how do we know that there are genetic components that impact mental health? Have you ever thought about the differences between closely related disorders and how do we differentiate one from the other? How do we know where to set those lines so that we can differentiate? And also along those lines, how do we know which interventions appear to work and which ones maybe aren't so good? We could ask whether research is useful in clinical practice and would be useful in your clinical practice. We could ask if you intend to use research, and if so, in what capacity. In terms of clinical research, we could also say, are you able to use research now? If so, what kinds of research? Are you able to conduct your own research? If you have a job that has clients, maybe you would know how to do some research to track efficacy of interventions and that kind of thing. Hopefully you know how to get into the databases and social science databases and look up research articles and read them and be able to make heads or tails out of what the studies conclude and perhaps even be able to tell a little bit about whether or not it's a good study or maybe a not so good study. One of the things that I wanted to remind you of, and you've hopefully seen this from your readings, is that research is required at all levels of being human, from the chemical and the molecular cellular levels to interpersonal and societal interactions and everything in between. So we need to know a little bit about all those things, maybe a lot about all those things. All of those types of information are useful to us, and all of them fit under the umbrella of abnormal psychology research. Now, the interesting thing is that you don't have to be a highly trained psychologist or social worker or psychiatrist or any of those kinds of people, highly trained social scientists, to be able to use and produce research. Now, granted, I wouldn't imagine that you'd be running some kind of complex research study that would require lots and lots of information that's above and beyond the scope of your master's program. But that doesn't mean that you can't use research and at least some kinds of research in your own practice so that you can become more competent in what you're doing and be better for your clients. And I wanted to say just real briefly, I mentioned the term translational research, which basically is a way that basic science is communicated to practical clinical applications. So that's translational research. All right, so let's talk about some ethical research standards. And somebody says, oh my God, you're going to talk about ethics? Let me just go ahead and get a pillow. I'm going to lay down and take a little nap. Wake me up when he's through talking about ethics. Well, I hear you. But hopefully what you're coming to understand in your program, your master's program, is that ethics play an important part in what we do and in terms of guiding our behaviors. In terms of protecting our clients, in terms of protecting ourselves for that matter. One of the things that I cover ad nauseum with people that I supervise for licensure is that the things that you do can really have a profound impact on your clients and can, under the wrong circumstances, well, let me just say that the wrong behavior coming from the professional can really do some damage, and so we have to be mindful of those things. Ethical standards are important to help protect all of us, and they make sense. Well, they make sense in research areas as well. Now, there are three big components of ethical research. One is respect for persons, and the idea there is that the participant in the research must be able to make informed consent, must be able to make decisions and to give their informed consent in terms of their participation. And if they're unable to do that, then they would have to have a guardian or maybe a parent or someone that would be legally competent and able to give consent for the participant to take part in the study. Beneficence, that's where we as researchers must respect participants' decisions and protect them from harm and to secure their well-being. For instance, it may be that you're conducting a study of some kind someday and somebody changes their mind in terms of whether or not they want to participate in your study. And ethically, your response needs to be that and at least in terms of the study, that's fine. You can't force people to be part of your study. That's unethical. The third standard or component is justice. We want to include all of those that are qualified to participate. Now, that doesn't mean that you don't, if you're doing certain kinds of research, that you don't use sample sizes or use sampling, random sampling and all that to get your people that you're going to study. But in general, you don't want to disqualify people based on discrimination and those kind of things. So respect for persons, beneficence, and beneficence and justice. Those are your three components to be thinking about. On the slides, you'll notice that I have something about IRB. That's called the Institutional Review Boards. Those are typically seen in institutions of higher education, colleges, universities, those kind of things. And basically, what the IRB is, it's a committee of scientists and administrators, I would imagine, and maybe even a lawyer or two. And what they do is they look at a proposal, a research proposal that you would submit to them, and they look to make sure that the participants are protected, that the institution is protected, and that you're protected, that you're doing things, proposing to do things anyway that are ethically sound and that meet certain standards. So I can tell you from experiences from my own research that the IRB process can be sometimes can be difficult, sometimes not, but in the end it's in everybody's best interest to have IRB approval. In fact, in most institutions, you can't do research without IRB approval. And of course, all that is governed by the Office for Human Research protections. Well, there's a little about ethical research standards. Now what I want to do is talk about two kinds of research that you can do as a practitioner to better help your clients and your ability to practice. So again, these aren't complex, expensive research pursuits that require a really good understanding of advanced statistics or research methodology or any of that. These are just some basic things that you can do and that you can employ in your own practice. So first of all, we'll start with case study, the good old case study. So a case study is a comprehensive description of whatever it is that's the focus of attention. It relies heavily on clinicians' practical experience, and it can be accompanied by quantitative measures. Now, as an example, I often use quantitative measures in my own practice, and in particular I'm thinking about a questionnaire that I give about depression. And so that when people first come in to see me, one of the things that they're given to fill out when they're in the lobby is a questionnaire for depression. I think it's PHQ-9 if I'm not mistaken, but I'd have to look. I don't remember off the top of my head up here anywhere. So, but anyways, it helps me to better understand what that client's experience is, helps me to understand whether depression is truly an issue for that person. It's a way for me to quantitatively measure what's going on with my client. It also provides me a way to track progress. For instance, if I have them to fill one out and then fill now and then fill one out later, I can say, well, okay, does this particular quantitative measure indicate change? And we'll get into that in a few minutes, single systems design kind of thing. We'll get into that in a few minutes, so just be patient for that. I know you're all real excited to hear about it, right? Right. Okay. Let's see. A case study can also provide background and detailed clinical information that's useful for you, and it allows investigation of unique phenomena. Now, one of the things about a case study is obviously it's focused on one case and isn't generalizable to other populations. So in other words, we can't say that Jim, for instance, that we've done this case study on Jim and we found out a few things about Jim, and now we're going to assume that these things that are true for Jim are true for other people similar to Jim's, that have complaints similar to Jim's complaint. No, we can't do that. These results aren't generalizable. I want to move on to single systems design, single case designs it's called in your book. Single case designs are experimental studies conducted at the individual level. They're quantitative in nature as opposed to qualitative. And if you don't know the difference between those two, I would like for you to look them up, because I could tell you right now, but I prefer that you would spend some time getting some practice looking for answers and being able to ferret things out on your own. That's an important skill to have as a social worker, especially a master's level social worker, because what you'll find in practice is that you won't have that you'll have complex problems to help solve, and that people won't be spoon feeding you answers and results and all that. Sometimes you have to go out there and be scrappy and dig for those and all of that. So, and it shouldn't be hard at all to find the distinction between quantitative and qualitative types of studies. Single case designs allows for inferences in the single individual. They're simple and cheap. You don't have to have a big bunch of money and again, a ton of expertise to be able to run a single case design. They're controlled experiments that are conducted with a single person. They control for alternative hypotheses, which basically means that there would be something other than the intervention that causes the change. And we'll talk more about those things in just a moment. The participant can be in the treatment or the comparison phase. And again, these types of designs are not generalizable. Again, it's one person that we're focused on, or maybe it's one institution, but it's one entity, whatever the case. We haven't done things that would allow us to generalize our results. Things like have random selection and a really big sample size and all those kind of things that go along with that. And again, ethics, we want to consider ethics. Sometimes it is unethical to withdraw a treatment that includes change, such as with suicidal ideation. So for instance, if we're doing something that has helped a person and they are no longer a danger to self or others, then obviously we don't want to take away that intervention and risk a return to self-harm. Okay, so, and this stuff is in your book too, so I want you to read that carefully. But with a single case design, basically we have A-B design strategies, A-B, ABA, that kind of thing. And so basically what we have is a baseline. We get a baseline. For the baseline, we have a measure of behavior that's targeted for change. So we take whatever behavior that we're looking for, that we want to see a change in, and we target that behavior. We measure it to see how things are before we apply an intervention. And so we designated that with the letter A. Now, then we provide the intervention. After we have measured and recorded the behavior prior to the intervention, then we provide the intervention. And what we can do then is we can see if there is a change, if the intervention appears to have caused a change. And after we see that, well, if we wanted to, what we could do is we could stop the intervention and then do another measure of behavior without the intervention to see what happens. Does the client revert back to the original behavior, the baseline behavior, or do they not, or exactly what happens? And so by continually observing these behaviors as these design strategies, the stages progress, we can begin to see whether or not an intervention would be useful. So again, we could have like an A-B design or an ABA design. Again, the B being the intervention and the A being observation periods. The first day, of course, being a baseline measure of behavior. And again, a continuous assessment is the key. We want to see what kind of behaviors are going on, not only at baseline or simple observation after the intervention, but during the intervention as well. Again, the idea, we're looking for changes. A single case design can be replicated, of course, by other people, other practitioners or scientists. Or if you wanted to, you could, of course, do your own replication of with a different client, or maybe even the same client later on. Plotting points on a line chart provides visual representation of change or lack thereof if change hasn't occurred. One of the cool things about single systems designs or single case design is that you can do a line chart I always got charts and graphs mixed up, the terms, but bottom line is that you can plot points and draw a line to those points, and you begin to see ups and downs, or how things, if you label the points, whether or not you're providing intervention and maybe a time frame for the points and that kind of thing. You can kind of see over time what kind of changes occur, if any at all. It's a visual representation that can quickly sum up your data and that you've collected, and can show you real clearly what kind of changes may be there. It's also useful to show the client that sometimes, which I've done that before too, especially working with adolescents in the past. And people sometimes don't realize how well they're doing or not doing, whichever may be the case. And so sometimes it's helpful to show your client some of these visual representations of their behaviors. So single case designs, they're relatively simple, something that they're easy to use, they're inexpensive. There's no reason not to use them. I use them myself on occasion. Same thing with the case study. A couple of other things I wanted to mention before we wrap up today is that there are various research resources for clinical research. And you may have noticed in your DSM-5 that there is a section that contains measurement instruments. I haven't used any of those. I do plan to look into them and perhaps use some of those. Some of them, I've glanced over them. Some of them look interesting and may be actually quite useful, but we'll see. That remains to be seen. I encourage you to look at them and perhaps consider using them and seeing how that works for you and your clients. I also want to let you know that a variety of resources exist in terms of things that you could do in terms of clinical research. There are little surveys that you could administer and those kind of things, kind of like the one I was telling you about earlier. One of the things you want to do when you find a resource, first of all, you want to look and make sure that it's available for your use, that you won't get in some kind of legal issue by using somebody else's instrument without permission or that kind of thing. But assuming that it's there for common consumption, then one of the things you want to do is look for validity and reliability of the instrument. It shouldn't be too hard to get on Google Scholar or whatnot, or look up that particular instrument and look for the validity and reliability of the instrument. As you may know, validity speaks to whether or not the instrument provides data that's reflective of whatever it is you're trying to measure, that you're trying to find out more about. And then of course reliability has to do with whether or not the instrument consistently provides data that pertains to, doesn't necessarily pertain to it, but we're talking about validity there. But basically with reliability, we're looking for an instrument that would consistently provide the same results. So, all right. In my concluding remarks here for this unit, I want to let you know that the most competent clinicians that I know engage in clinical research. They do things like use single system designs. They do things like do case studies and all that. So by doing that, it'll help you to be more aware and informed of outcomes in terms of what you're doing. Is what I'm doing working? Do I have any evidence of that, or am I just to assume that it works because it feels right, because I enjoy doing it, because the client seems to enjoy it, because Dr. So-and-so said that it was the right thing to do, all of those things. So it helps to be able to know via data that you collect on your clients what's going on. It puts you in the know, and it helps you to be more competent as a person. And it also helps with self-satisfaction. I sometimes do the single system designs or single case design, and I can plot the change that I see, and it's nice to be able to see that. It's rewarding to me. I show it to my clients. It's rewarding to them, and it's just a win. Or if they're not making much change, it helps me to know that maybe we need to consider a different route of intervention, or perhaps it's a wake-up call for the client to say, well, hey, it's time to for us to get to stepping, time for us to get to work on these things and try to affect the change that you reported that you wanted to make. And also, if you're able to do single systems designs and you use those, and case studies, and you use those well, and you tend to do some research to guide your practice, you'll generally be respected as a professional in the mental health community, especially as other clinicians begin to understand that the things you do tend to be research-based, and that it's just not that you're out there flying by the seat of your pants hoping for good outcomes. So those are some reasons to engage in clinical research. I hope that you're not like a lot of students that I've seen in the past, including when I was in school, that somebody would say research, and the students would act like they'd been hit upside the head with a frying pan or something, and it's like, oh my God, research. I don't want to talk about research. I don't want to do research. Don't need research. Oh, I just got to get through research class and I'll be just fine. So, oh Lord, just help me get through it. Well, that's the wrong way to look at it. Again, research can be very useful to you and your clients and make you into a more competent person. In fact, there's a friend of mine who is a psychiatrist that I have an immense amount of respect for, not because he's my friend or because he's a psychiatrist, but because I have learned about him that he gets into the research and is well versed on the types of disorders that he treats, and knows probably more about those disorders than anybody I've ever met. I mean, this guy knows his stuff. And that's the kind of people that I want to be around, and that I want to be like. And I hope that you're that way too, so that you can be very competent in what you do. All right. Well, listen, I hope you have a great rest of the day. Hope you're doing your readings, taking it all in, getting the most out of your educational experience. So take care.